Good morning, good afternoon, and good evening, everyone, and welcome to our WHO session as part of the 4th Global Oral Health and Climate Action Conference. My name is Gabriela Sardon, and I'm a consultant for the Oral Health Program at WHO, and I will be moderating the session today with my colleagues Benoit Varenne and Nicole Rendell, who you may be able to spot online. And we would like to start the session first by thanking the University of Pennsylvania for inviting WHO to contribute to this important event. It is a pleasure to welcome you to our session, which we have titled Environmentally Friendly and Less Invasive Oral Healthcare, a Life Cycle Approach. Next slide, please. So the objectives of our session today is to explore sustainable and less invasive approaches to oral healthcare, discuss the life cycle of dental products and practices from production to disposal, and identify actionable policy recommendations and cross-sectoral collaboration opportunities. And our session is divided in 3 parts. So we will have first an opening presentation on the life cycle perspective of dental medicines and preparations, as well as key highlights of the recent WHO guideline on environmentally friendly and less invasive oral healthcare. We will then transition to a multi-stakeholder panel discussion featuring UNEP, WHO industry, and civil society. And together we will discuss innovative approaches and strategic partnerships to support countries to implement environmentally sustainable oral healthcare. And finally, we will hand over back to University of Pennsylvania to wrap up our session with the key takeaways and next steps. Next slide, please. So without further ado, I will start the opening presentation. As I mentioned, it will introduce the life cycle concept or perspective on dental medicines and preparations, including oral self-care products. And we'll also share with you some of the key highlights of the recent WHO guideline. Next slide, please. So we have to start our presentation with the foundation for WHO, which is the Global Strategy and Action Plan on Oral Health, 2023-2030, which has the vision that universal health coverage for oral health will be achieved for all individuals and communities by 2030. And it includes 11 global oral health targets, including a specific one on environmentally sound oral healthcare. Next slide, please. So in the Global Oral Health Action Plan, environment is a cross-cutting issue. And the global target 1.2 is that by 2030, 90% of countries will have phased down or phased out dental amalgam by 2030. And this aligns with the Minamata Convention on Mercury, which is a legally binding treaty to protect human health and the environment from the adverse effects of mercury. Next slide. And this is further reinforced with the Bangkok Declaration, No Health Without Oral Health, which was adopted during the first ever Global Oral Health meeting in Bangkok, Thailand in 2024. The declaration reaffirms the commitment to implement a Global Oral Health Action Plan and adds a specific dedicated strategic area to oral health and the environment, calling to prioritize environmentally sound oral healthcare practices, such as efficient use of natural resources, sustainable waste management, reduction of carbon emissions, and the phase down and phase out of dental amalgam. Next slide. So when we talk about sustainability in oral health, it's not just about what happens in the dental chair. So today's discussion, we have framed it around the life cycle perspective, looking at dental medicines and products, including self-care oral products across their entire journey. So this means considering the environmental impact at every stage of the life cycle. So from raw material extraction and manufacturing to clinical use or self-care use, and finally waste management. So this approach, the life cycle approach, helps us to see the bigger picture and identify where we can make the greatest changes. Next slide. And we know we're not in this alone, so there is every stakeholder has a important role across the different stages of the life cycle. This includes industry, governments, health professionals, civil society, intergovernmental organizations, and many more. And we know oral healthcare is essential, but it also contributes to resource use, emissions, and waste. So aligning oral health care and sustainability goals is critical for planetary health. So collaboration and innovation are key to ensuring solutions that are safe for people and the planet. Next slide. So to put things into perspective, this slide shows the life cycle of mercury. And in our case, with this specific example of dental amalgam, while we often think of amalgam placement or removal taking place in the dental clinic, there are mercury emissions and releases that occur at many stages of the life cycle. So before and after clinical use, through mining or recycling of the mercury, manufacturing, waste disposal, and even cremation. And the Minamata Convention on Mercury is a global treaty designed to control, reduce, and ultimately eliminate mercury across all these stages to protect human health and the environment. And initially, dental amalgam was only subject to phase-down measures, but at the recent COP6, which was held just 2 weeks ago in Geneva, parties agreed to phase out dental amalgam entirely by 2034, which was marked as a historic milestone in reducing mercury pollution worldwide. Next slide. So in this context, WHO is currently executing a project to phase down the use of dental amalgam and supporting countries in policy development, capacity building, and waste management. The project is implemented by UNEP and is funded by the Global Environmental Facility, and it is executed with targeted technical assistance of the Global Mercury Partnership. So this slide is also to share with you a little bit more about the project, and you can access more information in the links that are available in this slide. I mean, we can include in the chat as well, so you can access it later. Next slide, please. Thank you. But as part of this project, what we wanted to share with you is that WHO has released its first ever guideline on environmentally friendly and less invasive oral healthcare for preventing and managing dental caries. And this guideline is based on rigorous assessment and synthesis of evidence and provides recommendations regarding the clinical effectiveness, safety and toxicity, cost effectiveness, and environmental impact of mercury-free dental products used for the prevention and management of dental caries. And the official publication will be released shortly, but you can access the main guideline already in the Minamata Convention website, as it was submitted as an information document to inform the discussions held at COP6 in Geneva 2 weeks ago. Next slide, please. And this guideline is based on 5 guiding principles that shape sustainable and patient-centered oral healthcare. So we start with prevention first. This is the most effective way to reduce environmental impact because we're preventing oral diseases before they occur and all the treatment that is needed. Also, sugar reduction and fluoride use. So this is essential for dental caries prevention. Detecting problems early and using techniques that preserve natural tooth structure also, minimally invasive care. Shared decision making, so making sure that patients are fully informed and involved in choosing their care options. And we also have as a guiding principle the precautionary principle, which means that when evidence is uncertain, then we prioritize safety and environmental responsibility. Next slide. So the guideline includes 8 recommendations and 2 best practice statements. And the clinical recommendations, which you have on the left, are grouped according to their primary indication. So, for example, for prevention of dental caries, non-restorative intervention for managing dental caries, and direct restorations. So the guideline, just so you know, excludes indirect restorations and advanced caries stages. And we also have 2 additional recommendations and 2 best practice statements addressing risk mitigation among clinical teams and patients, which are the ones on the right. Next slide. So the recommendations and best practice statements encompass professionally administered mercury-free dental products and medicines for preventing and managing dental caries, which are the ones that you can see in this slide. For example, fluoride varnish, glass ionomer cements, silver diamond fluoride, and resin-based materials. So these are presented as clinically effective options and more sustainable ways as well to manage dental caries. And there is more information about each of the materials, such as what was mentioned before, effectiveness, cost effectiveness, toxicity, environmental impact, in the guideline that will be released shortly, the official publication. Next slide, please. So in addition with the core recommendation and best practice statements that the guideline has, there are 2 additional important chapters that are included. So first, there are implementation considerations. So these cover some practical steps for countries such as ensuring supply chain and market availability of these mercury-free materials, training oral and other health professionals, improving waste management in oral healthcare facilities, and adopting practices that preserve ecosystems and support sustainable development. And also there's a chapter on research needs as well, because this guideline highlights the gaps that require further study, such as clinical and cost effectiveness of mercury-free products, monitoring occupational exposure, and understanding environmental risks and sustainability across the full life cycle of dental materials. Next slide. So this is the slide just to conclude the presentation. Is that based on the WHO guideline, it's clear that prevention comes first. It's the most effective way to reduce environmental impact, to stop oral diseases before they start. And when treatment is needed, we should use mercury-free and minimally invasive care using safe and sustainable products. We also need to think about the life cycle in everything that we do in the oral health sector. So considering this environmental impact and what can be improved at every stage. So from manufacturing to clinical or self-care use to disposal. And finally, that oral health needs to be connected to global frameworks, such as what we saw, the example of the Minamata Convention on Mercury, but also the forthcoming UN Plastics Treaty, the Sustainable Development Goals, and the COP30 Climate and Health Agenda. Because, and this is the last message to leave you with, is that integrating sustainability into our health systems is essential and supports the WHO guideline that was just presented and the Global Oral Health Action Plan vision on achieving universal health coverage for oral health by 2030.